Good evening, guys. Good morning. It's Dr. Schulz, MD5, coming with another COVID-19 update. It is 7:30 in the evening, Friday the 20th. And I bring that up because that's going to be relevant here in a minute. Because today we're going to talk about two things. We're going to talk about some numbers, just see where we are nationwide and in Texas in terms of number of cases, number of deaths, those kind of things. And then we're going to talk about testing, because testing is a big hot topic right now. So real quick, first on the numbers, in the U.S., as of about 1930 on the 20th, there's 19,101 confirmed cases in the United States, and that is going up. I mean, I remember seeing on the news yesterday somewhere in the 15, 16, 17,000 range as it continues to rise. So the numbers are going up, and we have 244 deaths confirmed in the United States. Texas is starting to get up there. We have 194 cases confirmed in Texas as of now, with 5 deaths, and several that are. And there's, I'm sure, plenty of tests that are out that may come back positive. So that number may go up by the time I finish recording this video. And in Harris County, we're number one, highest number of cases in the state from a county standpoint, with 24 cases, and we've had 1 death in Harris County. So that's the numbers. That's where we are. And so let's talk about testing, because testing has been a real hot button issue lately. Who should get tested? Who shouldn't get tested? What's going to happen as these testing centers come online, and why we don't do screening tests, prophylactic kind of screening. And so we'll talk a little about that stuff. And there's 2 real things that contribute to who's getting tested. All right. So there is a logistics component. There's no doubt about that. The availability of testing. And we're going to see that expand here in Texas and in Harris County and in Houston markedly over the next week or weeks. I will say that to date, we've only tested 5,277 patients in Texas, and we got that 194 cases out of that. So it's a relatively small number that have been tested in Texas as of now. That's going to be going up significantly, and the governor has put forth numbers. He wants to see between 15 and 20,000 cases a week be tested. And so, what that looks like, that's going to be more of these drive-through screenings. It's going to be more hospital capability testing at hospitals, testing at outpatient clinics, things like that. So there are certainly a number of things that are going to happen as the testing comes online. First of all, more people are going to want testing. And as we test more people, especially people with kind of more mild symptoms who wouldn't get tested last week at the hospital, now maybe get tested as the capacity increases, we're going to get more cases. The numbers are going to go up. All right. We haven't done enough at this point as a society to kind of cull that number. So it's going to go up. I'm just telling you right now. But the other thing about it is that we're going to see people looking to get tested. And I've had a lot of guys ask me, why don't we test firefighters? Why don't we test first responders just flat out? Why don't we test? Why can't I go get a test? Why can't my doctor order me one? And so the real thing behind that, again, is twofold. It's logistical, and it's scientific. It's science. It's biology. On the logistics side, we just still, no matter what you hear, as of this moment, we don't have enough testing capacity. We just don't. And that doesn't necessarily mean test kits. We may have the number of test kits we need, but it goes into everything else. In general, the viral swabs, the little swab sticks they stick up your nose to get the sample, and the viral transport medium, the stuff in the tube they stick the swab in to take it to the lab, those are both in shortage. There are places that can't get those. So they could run the test, but they can't collect the test. So that is one of the reasons why we haven't expanded markedly in the testing as quickly as I think any of us would have liked. Additionally, you've got LabCorp and Quest have come online, but they're talking about volumes in the 15 to 20,000 tests that they can run, and that's a big number, but it's not that big of a number, right? And that's nationwide. So there are some things that need to happen to help increase the testing capacity, and that's coming, and you're going to see that coming. But with it will come higher numbers. So that's one reason. But the other reason is science and why we don't test asymptomatic people. Okay. And the problem is, as a general rule, a negative test in an asymptomatic person really doesn't tell me anything. Okay, so we've talked before about the 24-hour period that you're really not creating and shedding virus. You wouldn't be contagious. But if I get exposed tonight, I'm going to go to the hospital after I finish recording this. I'm going to see a bunch of patients, and let's just say I screw up my PPE and I get exposed. Okay, I get exposed tonight. It's Friday night, and say I get tested on Monday, which is day 3. Okay, my test is negative. Awesome. Problem is, the incubation period for COVID-19 is 1 to 2 to 14 days, which means if I get tested on day 3 and it's negative, even though I've been exposed, it's negative, that doesn't mean I can't develop the disease on day 4 or day 5 or day 14. So a negative test when I have no symptoms doesn't really do me any good. Now, if I get symptoms, if I get lower respiratory symptoms, if I get a fever, and then I get a test and it's negative, okay, well, I'm pretty comfortable that the symptoms I'm having are not from coronavirus. They're from the flu or a cold or whatever. But if I have no symptoms to guide it, yes, could I theoretically test positive? It's possible. Generally, if you're asymptomatic, the viral load, and you have been exposed, you are infected, the viral load's a lot lower, so you may get a negative test, which may turn positive tomorrow or the next day or the next day. So in reality, the testing of asymptomatic patients really isn't recommended. And when I say not recommended, I don't just mean me, all right? I'm talking about all the places that we look for guidance from these things, right? That includes, obviously, the CDC, everything we've been trying to do with the Houston Fire Department, and everything that most of the hospital systems and everyone are trying to do, largely driven by the CDC, the Center for Disease Control and Preparedness, or Center for Disease Control and Prevention. Sorry, it's been a long day. But anybody who you would kind of look to from a leadership standpoint on this stuff, the American Medical Association, the Texas Medical Association, the Infectious Disease Society of America, it's kind of what they do for a living. I've spoken to infectious disease specialists in hospitals and healthcare systems around the city and the state, and everyone's got the same recommendation. We really shouldn't be testing asymptomatic people. It's not a screening test. This is a test to confirm whether the disease that someone has, the symptoms they have, are caused by COVID-19. And if we think about the test that way, that explains kind of why we really can't screen independently asymptomatic people, because it just doesn't make a lot of sense. Add to that our logistical challenges of enough tests to take care of all the people who are out there, and it really doesn't kind of add up that we should be screening asymptomatic people. So that's the reasoning behind that. Certainly symptomatic people need to be tested. Now, lower respiratory symptoms, fever, those need to be tested. And most sites that I'm aware of do have some level of priority for healthcare workers, because they understand that to beat this thing, we need to keep you guys in the fight, right? We need to get you tested and get you back to work, because a 14-day quarantine is a big hit for you personally. It's a big hit for your family, and it's a big hit for your fellow crew members who are going to have to pick up the slack while you're gone. So certainly most places will prioritize healthcare testing, but you have to have symptoms to qualify. And all of the sites that I've seen so far come online have some form of a screening where you have to have some kind of symptoms to get in order to be tested. And this is why. This is the appropriateness of it. They're not just trying to discriminate against people who don't have symptoms yet. We're just trying to catch the people within that are symptomatic and make sure we know who needs to truly quarantine. All right. So that's all I got on that. If you have any questions, Dr. Kevin Schulz, I'm in the global directory. You're welcome to reach out via email. I'll do my best to get back to you. Certainly infection control. If you do get symptoms, if you get exposed, call infection control. If you get symptoms, whether you know you were exposed or not, call infection control. You're a healthcare worker, so you are at a higher risk of getting exposed. Call infection control, all right? And they can help sort through kind of the risk, as well as if you have symptoms. We're working on some things where infection control will be able to help get you tested. We're not quite on that yet, but we're getting there. So please, Make sure you let us know, wear your PPE appropriately. We've talked a bunch of times, but if you wear the PPE as recommended, you should not be at anything more than a low risk. And just go ahead and stay safe out there, and I'll see you guys around.